Welcome to MyPatchLink.com's video series on allergic contact dermatitis. In the short video you are about to watch, you will learn a broad overview of patch testing products, and how to interpret results.
Hello, my name is Dr. Kurt Hammond, and I'm going to speak to you today about patch testing. You should print the handout that goes along with this video. I will be referring to it throughout this presentation.
What is patch testing?
Patch testing is a controlled application of biological or chemical substances to the skin. It is used to detect an allergic sensitivity. Small amounts of test substances diluted in a vehicle such as water or petrolatum are applied in a chamber to the skin under a patch of cloth or paper tape. The patch is left in place, usually on the upper back, for 48 hours, after which the skin reaction is examined and scored negative, meaning no reaction, to 3+ positive, indicating swelling, blistering, and redness of the exposed skin. Patch test allergens available include Trolab, Chemotechnique, Allergies, and TrueTest. Patients may also provide their own products for testing, such as shampoos, cosmetics, or industrial chemicals like cutting oils. Patch testing chambers are available as either round, such as Thin Chambers and Curatest, or square chambers, such as Allergies, IQ, and Vanderbilt chambers.
When should a patch test be conducted?
Patients that have persistent and frequent dermatitis, especially on their hands, are good candidates for patch testing, as are those with atypical allergic symptoms and show no improvement with treatment. Additional patch testing indications are available in your handout.
How do you patch test?
There are several key steps involved in patch testing. For further information, please refer to your handout. To begin, first take the patient's history and conduct a physical examination. Be sure to ask questions about the patient's occupation, family medical history, and existing conditions. At this time, look for distribution clues on the face, hands, and ears. Your handout will provide further information on this. Next, counsel your patients about the nature, goals, and the limitations of patch testing. Be sure to tell them to wear loose clothing during the testing. Have them stop oral and topical corticosteroid medications 2 to 3 weeks prior to testing, and avoid exercise and showering while the patch test panels are on their skin. After you have consulted with the patient, you will need to determine sequence and allergen placement and prepare the patient's patch test data form based on your patient's physical examination and distribution clues. Next, you either select TrueTest, which is ready to use, or individual allergen preparations, which require numbering chambers and filling them. Be sure not to pre-fill volatile allergens. Also, liquid allergens may require a filter paper in the chamber. At this point, you prepare the skin. Preferred sites are the upper back or the upper arm. Make sure the area is free from hair. If necessary, have the patient shave prior to the visit. Also, make sure it is free from ointments and lotions. Your handout provides you tips on this step. Then, place the panel on the skin. Remove paper backing just before the application. Apply the panel or panels to the upper back if possible. Mark the panel notches or corners with a surgical marker to ensure patch location detection upon panel removal. After the panels are placed, instruct the patient to refrain from exercising and getting the panels wet. Inform the patient that itching and burning are common reactions. Further information is provided in the handout. At about 48 hours, you will remove the panels from the skin. Remark the notches or the corners of the panels. Then remove the panels and verify occlusion. If you are going to do a reading at 48 hours, wait 15 to 20 minutes to allow transient erythema from occlusion to subside. It is important to note that positive reactions at day 2 should not be considered positive unless the reaction persists into day 3 and beyond. True allergic reactions should persist or appear at day 3 and/or day 4. Next, you will read and record the results of the patch test. Reactions occurring at day 7 or later are considered late reactions, and delayed positive reactions may appear at day 5 or later. The handout will provide standardized interpretations of reactions. It will also provide reading challenges that clinicians may face. Once results have been interpreted, you will discuss positive and negative results with your patient. For positive results, discuss where the allergen may be found at work and at home, what products are likely to contain this allergen, and the steps you can take to avoid it, including identifying alternative products. If all allergens tested were negative, tell your patient that their dermatitis is not caused by the most common allergens for which they were tested. It is common to receive negative test results, and even these help you to diagnose and refine the treatment. Additional testing of less common allergens may be necessary. In conclusion, patch testing is the most accurate way to determine if a patient suffers from allergic contact dermatitis. With practice, you can become a successful patch tester. Thank you, and I hope you have found this video helpful.
Additional resources and information are available to you at mypatchlink.com/resources.